Welcome to Managing Myeloma. I'm Dr. Sagar Lonial. I'm frequently asked, is there a role for Bcl-2 directed treatment for patients with translocation 1114? And I think that this is really an important and actually exciting question because for years we've been talking about using biomarker-directed therapy in all of cancer, and in myeloma we don't really have biomarker-directed therapy. But what we know about the Bcl-2 inhibitor venetoclax is that it does seem to have preferential activity in the context of patients with the 1114 translocation. There's a lot of really good biology to evaluate this and try and understand why this is, but if one looks at a single agent response rate of venetoclax in relapsed refractory myeloma for 1114 translocated patients, the overall response rate's about 40%. If you add dexamethasone to that, venetoclax dex for 1114 translocated myeloma, the response rate jumps to 60%. Now, we actually at Emory have a system where we actually do BH3 profiling and can identify whether that response rate can even be higher based on sensitivity to venetoclax in vitro using assays. And with that approach, we've been able to significantly and effectively predict almost all of our patients responding versus not responding to a Bcl-2 directed therapy like venetoclax. So I think clearly there is a role for 1114 directed therapy with Bcl-2 inhibition. The question is, can we expand it even beyond that? And there is very exciting data coming from Philippe Moreau and another collaborative group evaluating venetoclax in combination with bortezomib and dexamethasone, suggesting that even in non-1114 patients, in patients with bortezomib resistance, you may be able to overcome that by adding in venetoclax in a small subset of patients. So I think there's more story here to come. The use of bortezomib and venetoclax is clearly very active, but venetoclax dex in 1114 positive patients does represent a biomarker-driven therapy and one that I think we're all very excited about. Thank you for viewing this activity.